I'm going to start talking about kidney disease, and then to work with that, you have to deal with blood pressure. So there we go, back into blood pressure. At rest, your kidneys receive about 25% of the blood pumped by your heart. Now, you know, that doesn't seem like too much, except your brain only takes 15%. And so your body gives the vital organs the most, right? So which would you rather have, kidneys or brain? Well, I think you probably need both. Can't live without either very well. The ancient Egyptians, as I say here, and the Mesopotamians believed that the kidneys were the source of your vigor, strength, and your wisdom. I don't know about the wisdom part, but anyone that goes into kidney failure will tell you they don't feel very vigorous anymore. It's not a good thing to go into for sure. Normally your kidneys filter about 180 liters of blood a day. Now that's a lot of filtering. They have to work pretty hard to do that. Your blood, because of that, is filtered about 60 times a day, which means those kidneys are working a lot. And each kidney has about 1.3 million filtering units, or nephrons. You know, you think about the size of a kidney, it's not too big, and it has 1.3 million filtering units. That's a lot packed into a little bit of an organ. And most of us are born with two, not everyone, but most of us are. It's really important to keep your kidneys functioning in top form, because once you start getting problems with the kidneys, your risk of other diseases go up as well. And so you want to take care of those kidneys. There are multiple causes of kidney failure, and I've listed them there for you on the bottom of that first page. Diabetes, hypertension, various autoimmune diseases can do it. I had a patient come in last fall, and he was in good health, and then all of a sudden his kidneys failed. He had a vasculitis, which is a type of an immune disease that just sent him right into dialysis. Fortunately, with those diseases, if you get treatment promptly, often you can reverse the kidney failure, and his kidneys fortunately are improving. But autoimmune disease can cause problems like lupus. You can get a lupus nephritis or an ANCA vasculitis, some of those. I won't be talking specifically about the treatment of those tonight, but if someone wishes to after our presentation, I can talk with you about that. Then there's urinary obstruction. If you get an obstruction in the tubes that come from the kidneys to the bladder, that'll cause kidney failure. You've heard of kidney stones. Usually you know when you have one if it gets plugged in the ureter there and stops the flow. If it isn't fixed soon enough, that kidney will fail. And if you have obstruction of the blood to the kidney, a narrowing of the artery to the kidney called renal artery stenosis, the kidney can fail too. So both kinds of obstruction, both vascular and urinary obstruction, can cause kidney failure. And recurrent kidney infections can cause kidney failure too. So if you have a tendency toward urinary tract infections, make sure you get those taken care of. But the most common causes of kidney failure have to do with diabetes, hypertension, and atherosclerosis. They go hand in hand, and that's why diabetics, you always hear, well, they're at high risk for kidney problems, because really what we're doing is accelerating deterioration of the blood vessels in the kidney. I mentioned several others there, medications. A lot of people don't realize it, but ibuprofen and naproxen and naproxen, those are non-steroidal anti-inflammatory drugs, and I've seen people go right into kidney failure from those. Even taking them occasionally can be stressful on the kidneys, So be careful, and people say, well, I don't take those, I take Tylenol. Tylenol is hard on the kidneys too. And so if you need pain medication, you can use it, but use it judiciously. Never take more than you absolutely need to, particularly of those types of medications. Antibiotics, there's certain antibiotics that must be monitored very closely. Another one that's very often used, for a while it was the top seller in this country, and that's proton pump inhibitors. Those are used for ulcers and gastroesophageal reflux, like omeprazole or Prilosec and pantoprazole or Protonix, Nexium. That whole class of drugs does cause kidney impairment. Doesn't usually cause kidney failure out and out, but long-term use impairs kidney function. And so while some people say, well, I don't need to change my diet, I have acid reflux, but it's not a big problem, I just take my Prilosec. Yeah, but that can cause a problem with your kidney function. Sometimes you have to take that because you're at risk for esophageal cancer or something else. But whenever you can change your diet enough that you don't need that, you're far better off. One of the number one problems that causes acid reflux is a little drug called caffeine. Of course, nobody here uses that. It's found, of course, in coffee, tea, and chocolate. And often if people eliminate those from their diet, they have much less problems with reflux, and then they can get off their proton pump inhibitor, and then they save their kidneys. If your kidneys have problems, of course, that can drive your blood pressure up, and if your blood pressure's high, it can cause kidney problems. They're in balance there, which is why we have the two topics together tonight. Now, I skipped a paragraph there, and that's about protein. Protein intake is absolutely essential for life. We can't live without protein, but protein is very interesting. It's different from carbohydrates or fats. If you eat fat that you don't need today, and of course none of us overeat, I realize that, but you may know someone that does. And so if you eat fat or they eat fat today that they don't need today, what happens? You store it, right? And if you eat sugar that you don't need today, if you're not going to burn it, you store it. And you can store it as glycogen in the liver, or you can change it to fat and store it. But if you eat protein today that you don't need today, you excrete it. You do not hold on to protein that you don't need. So if you eat excess protein, you excrete it. And how do you excrete the byproducts of protein? Through the kidneys. And so excess protein, particularly animal protein, causes hyperfiltration. That means excess work for the kidneys. And if you put the kidneys to excess work by eating more protein than you need, you're going to cause trouble with the kidneys. And you're going to have problems with high blood pressure as well. Question?
So, I was reading about sarcopenia,
Sarcopenia, muscle wasting.
especially for aging.
Yeah, sarcopenia in aging is not from protein deficiency, usually. It's from inactivity, not being active enough. They did a study at the VA hospital in California, it's been probably 30 years ago now, where they took 3 men who were 100 years of age or older, and they put them on an exercise program. They all had sarcopenia, which just means less muscle, and they all built muscle. They didn't put them on a high-protein diet. You know, people say, well, you got to have a lot of protein to build muscle. Well, how much protein does an elephant eat? Well, it eats quite a bit because there's quite a bit in green grass, but it's not excessive amounts, and they're a lot stronger than you or I. Years ago, Henry David Thoreau said something interesting. He said, the farmer says you have to eat meat for muscle strength while he walks behind his ox who eats none. So, you know, this goes back and forth. I deal with trainers at gyms all the time, and they're telling my patients, you need to eat 120 grams of protein a day to build muscle. Nonsense. But the one nice thing about that is if they do it, I'll have more patients with high blood pressure and kidney failure to treat. So no, you don't have to have excess protein. The recommended daily allowance for protein is about 0.5 to 0.7 grams per kilo, depending on if you're a man or a woman. Actually, if you look at the studies going back to the 30s on how much protein you need, it's a lot less than that. They actually found that you need about 25 to 30 grams of protein a day. And if you get that, you'll be fine. What they actually did is they doubled it just to make sure. And that's where they came with the 70 grams of protein per day for an average man. 1 gram per kilo, which tells you the average man used to weigh 70 kilos. They don't today. They're a lot heftier. And it's not muscle weight, it's FAT. So we way overestimate the amount of protein we need. I think a good rule of thumb is 0.6 grams per kilo per day, and that's plenty. 0.7 for men if they're really active, 0.55 for women, somewhere there. But protein is a non-issue for most people that are getting adequate calories. You rarely hear of protein deficiency. It's protein calorie malnutrition, because if you get enough calories, then the body doesn't suffer from protein. But most of us get too many calories, not enough. The only time that I encourage patients to eat more protein is when they're very elderly and they're having trouble with wound healing. Then that may be an issue, but rarely. So particularly animal protein is problematic because it is high in sulfur, methionine, and cysteine. And the average patient who has kidney failure or impairment, if I can get them off of animal protein onto plant protein alone, which is much less acidic, often their kidney function will improve markedly. I remember years ago I had a type 1 diabetic whose kidneys had failed, and her boyfriend, who became her husband, donated a kidney to her. That was wonderful. She did very well for quite a while, and then that kidney started to fail. And she came to me and she said, is there anything you can do to help me? I said, well, I work with type 2 diabetics all the time and I can help them. And she said, well, I'm a type 1. I said, well, we can try. So I put her on a whole food plant-based diet, and her creatinine was 2.5 when we put her on it. Normal for her would have been about 0.8, and her creatinine fell to 1.5, and her kidney, transplanted kidney, stabilized, and she had no more problems with it because she eliminated animal protein.
So can I ask one more question?
Sure.
So you know protein shakes are popular.
Protein shakes are popular, and we shouldn't have them.
So because I know there's like a whey protein.
Yeah, and if you want to eat a whey protein shake, go ahead, and you'll increase your risk for breast cancer. That's, gives me more business. If you're a woman, increase your risk for prostate cancer. We can help you with that too, but I don't recommend it, and it's not good for your kidneys either. Whey protein is from dairy, right? Well, we know that very clearly. There was a Harvard study published in 2001 that showed men with the highest intakes of dairy had a 400% increased risk of prostate cancer. I used to like cheese, but after I read that study, cheese started tasting to me like prostate cancer. So I quit eating it. I kind of lost my appetite for eating prostate cancer. Question?
I have a question. How long does it take for your body to change, like if you're a vegetarian and you go to plant-based diet?
It takes about 2 weeks. You won't like the food probably the first week, and you'll have a lot of gas because you'll be eating a lot more fiber. We ran a course here at Parkview for 25 years called Lifestyle Choices, and we ran people through the program, and for the first week they were complaining of gas and this and that, and the second week they were saying, I haven't felt this well since I was 16. And you know, it makes a difference. You can change. And remember, your taste buds turn over completely within about 2 to 3 weeks, and you can get new tastes. So you'd survive it. Although, you know, it's kind of hard. It's better than dialysis, though. So it's really important, if you want to preserve your kidneys, to limit your intake of animal protein. Plant protein doesn't seem to have the same effect unless you get into these protein shakes and pea protein and all this extra protein added in, then you can get a problem with that too. You've got to have a lot more because it isn't as rich in sulfur, it's not as acidifying. But if you want to preserve those kidneys, don't overdo protein. Very, very important. So keep that in mind. All right, so yeah, question.
In Dr. Greger's How Not to Die book, it
Mm-hmm.
is How Not to Die from Kidney Disease.
Right.
He has a chart in there that shows the acidity effects of flesh, and fish is higher than all of the other.
Yeah, you know, people often say, well, you got to have fish because it's a lot better for you, but fish is harder on the kidneys than chicken or beef. You know, I'm not going to recommend that you eat more chicken or more beef because fish is bad. I'm just going to say don't eat fish and think you're doing your kidneys a good turn, because in fact it's harder on the kidneys than than the other sources of animal protein. Sorry, folks, you know, but if you want to live longer, or you want your kidneys to live longer anyway, it's worthwhile. Hypertension is probably the most common cause of of kidney failure, and diabetes is probably the second most common cause of kidney failure. Hypertension, if we could put our finger on one thing that would save the most premature deaths, lengthen life the most, it would be reversing hypertension worldwide. No question about it. And hypertension is primarily diet-related and lack of exercise. So there it is. And here's some causes of hypertension. For us to save our kidneys, we need to normalize our blood pressure. Inadequate production of nitric oxide by the blood vessels. Nitric oxide is what dilates your blood vessels. It's you get enough nitric oxide, the blood vessels relax, it lowers the pressure, the heart's happier. It's just a really good thing to have around. And salt, sodium, decreases nitric oxide production. If you have a salty meal, within 30 minutes your blood pressure will go up, just from blocking nitric oxide production. The flip side of that, though, is if you have a meal that's high in potassium, potassium increases nitric oxide production, and so you relax your arteries. So you'll want to have a diet that's rich in potassium and low in sodium. And if you want to look at the bottom of the third page, there's a list of foods that are high in potassium, and you'll notice that banana, that gets all the press, is rich in potassium, but it doesn't make the top 10. If you want to raise that nitric oxide and lower your blood pressure, you're going to start off with greens for several reasons. One, they're rich in potassium. Two, they're rich in arginine, which is a precursor of nitric oxide. So eat those greens, just leave the salt off of them, and they'll lower your blood pressure nicely.
Isn't potassium hard on the kidneys though?
Potassium is not hard on the kidneys if the kidneys are functioning normally. If you have severe kidney disease, you have to be careful with excess potassium, because the kidneys, when they stop functioning well, sometimes can't clear potassium from your body. So if you have severe kidney disease and your potassium is running high, you have to be careful. But if you have no kidney disease or only moderate, high potassium is good. Do I recommend supplementing with potassium pills? No, partially because of this. However, if you want to lower your sodium and just can't kick the salt habit, get a sodium substitute that has some potassium salts and some sodium salts. It tastes about the same as long as the potassium isn't more than a third. And then you're doing better. That's one of the reasons Cheryl mentioned Himalayan salt or sea salt. It has some potassium in it and other minerals, and so it doesn't push your blood pressure up quite as much. Just because it doesn't push it up quite as much doesn't mean you want to put twice as much salt on, though. You know, we humans, we do funny things. Yes?
I'm noticing that the Swiss chard and the spinach are listed as cooked.
Yeah, cooked. I mean, you can absorb the potassium fine. The only reason I put it cooked is because a cup of raw Swiss chard is a lot less than a cup of cooked Swiss chard. Now, I mean, how are you going to pick? You can't get it in. But just to show you that, and you can eat it any way you want. You'll get the potassium out of it if you chew it. If you swallow it whole, you probably won't get as much. Question?
Yes, my sister, who's a big Esselstyn fan,
Right.
says that she always puts a few drops of vinegar on her greens because it helps release the nitric oxide.
Yeah, I don't buy that, although, you know, a lot of people like vinegar. I don't think you have to do that. I think you have to chew it. But if you like your vinegar, just don't do too much. It's an acid as well. And if you get enough of it, you can cause esophageal ulcers and different things. Better to use a citric acid or lemon juice. I don't use citric acid powder. I'd say lemon juice because it's not as strong an acid.
And you want to be careful with vinegar as it relates to your microbiome as well.
Yeah.
Because it affects that.
Yeah, because it kills bacteria, and you need some bacteria. All bacteria are not bad. This is a great class. Everyone has questions.
How does oxalates fit in with spinach? Because I had read that.
Okay, question about oxalates, and now we're back to kidney stones. If you have trouble with kidney stones, you have to be careful with oxalates. No question, there are some greens that are lower in oxalates than others, but the biggest problem with kidney stones is not oxalates, it's too much salt. Sorry, and not enough water. Right. If you want to avoid kidney stones, your first thing is not oxalates, it's water, and the second thing is reduce your sodium intake. But no one wants to do that. They want to avoid the oxalates. Oh well, they don't like their spinach, I guess. All right.
Can you define moderate kidney disease?
Okay, can I define moderate kidney disease? There's stage 1, 2, and 3 of kidney disease, and 3A and 3B and 4 and 5. 5 you're on dialysis or almost. 4, we're talking about glomerular filtration rate. The normal kidneys filter greater than 60 milliliters of blood a minute. Stage 3B, well, stage 3A is under 60. It's in the 50s. And then B is down in the 30s, 40s, and, 30s. And then down to 4 is less than that. It's in the 20s or less. So, I won't get personal with your kidneys, but you can have potassium. We'll put it that way, okay? I wouldn't take potassium supplements if I were you, but I would eat high potassium food. That'll help your blood pressure as well. Preserving your kidneys. Now I've lost my place. Here we go. Causes of hypertension. Another one that we talk about in addition to the nitric oxide, and I mentioned arginine and citrulline. They help, the more you eat of that, the higher your nitric oxide levels go. And arginine is found in arugula, beet, spinach, It's also found in garlic, and citrulline is found in watermelon and muskmelon and cucumber. All of those will lower your blood pressure by increasing nitric oxide. And then there's excess glycated end products. Those cause hypertension. This is the problem with diabetes. Anytime your blood sugar runs high, you glycate the red cells, you glycate the blood vessels, you stiffen it all. And if you're trying to push blood through a stiff blood vessel, you're going to need a higher pressure. If your red blood cells are stiff, and I've used this illustration many times, red blood cells are 7 to 8 microns in diameter. The capillaries are 3 to 4 microns in diameter. How are you going to get a 7 to 8 micron red cell through to a 3 to 4 micron capillary? You're going to have to deform it, squish it down. That's a great design because it maximizes the surface contact between the red cell and the capillary, facilitates oxygen delivery and CO2 uptake. But if that red cell is stiff, it ain't going through there unless you raise the pressure. And if I have a diabetic that comes in and their blood pressure's up, the next thing I do is check to see what their A1C has been, because if their blood sugar's been running high, their blood pressure's going to go up too. But that happens in non-diabetics too. Now, glycation is irreversible until the red cell is replaced, 3 months, and then the red cells turn over. So, high blood sugar, even if you're not a diabetic, raises your blood pressure. Just remember, they're two white powders, salt and sugar, and both will raise your blood pressure. So lowering your sugar intake, eat the dates instead of the honey, have the date butter instead of the maple syrup, your blood pressure will come down. Those are important. It's a similar thing with alcohol. It's a refined carbohydrate, and it raises your blood pressure through several mechanisms as well. And then there's exogenous advanced glycated end products. Those of you that are interested in this, look up the 2008 June issue of American Dietetic Association, the work by Jamie Urabari. He's a nephrologist, that's a kidney doctor, and he realized that advanced glycated end products in food raise your blood pressure and cause problems with your kidneys. And he tested 500 different foods and measured how many glycated end products were in those. And here's some examples. Apples are about 17 kilounits of aged products per 100 grams, and bananas are about 10, and potatoes, if you boil them, are about 17, and then you French fry those potatoes and it goes to 1,544. And if you want, you can have some chicken, and if you boil it, it's about 900, and if you fry it, it's about 9,000, and if you barbecue it, it's about 18,000. And so if you really want to do your kidneys in, have some fried or barbecued chicken, and you get all that glycated end products in there, and those are proteins that are stiffened and twisted permanently, and then you try to use them and you absorb them into your body, and they're hard to absorb, and it causes inflammation, which worsens your blood pressure and worsens your kidney function, and on it goes. But if you really want to do someone in, just feed them a little bacon fried, and it's 91,544. And that'll really push your pressure up and give me more business. So you can try that, or you can not. Another cause of high blood pressure is inadequate exercise. Our blood vessels are like the roads, right? That's what we carry stuff through our body on. It's, I saw someone today that was a door dasher. Have you ever heard of a door dasher? Yep. Well, they'd go, if they were in your body, those door dashers would go through the arteries and the veins, and that's really important. But if you don't exercise, your body says, well, they're not using these roads very much. We'll just let them kind of, fall apart. But if you get out and exercise and the blood starts pulsing through there, then the body starts saying, hey, maybe they are going to use these arteries. Maybe we ought to clean them up and get them working. And so exercise is wonderful. I recently, because my wife made me, got a treadmill for my desk at work. I got a standing desk and I've got a treadmill, and I should look and see, but you know, it's amazing how many more steps I'm taking a day now that I have a standing desk and a treadmill. And I get on that thing and away I go, and I'm getting, you know, when I go to work, I'm getting 15,000 steps a day. And when I'm not there, everybody else hops on it. And, you know, just movement is really important to lower your blood pressure. It's critically important, and that'll save your kidneys. Remember, the kidneys are very, very vascular. They've got miles and miles and miles of blood vessels tucked in those things, and anything you can do to improve blood flow will improve your kidney function.
Excuse me. I don't know.
Question.
Yes. What if you can't exercise for one reason or another, like surgery for the extended period of time?
Well, you can do some exercise.
Weights?
Lift weights, you know, move. Whatever you do, they'll never put you in a box while you're moving, so don't sit still long. I mean, we were made to move. Question.
Can I ask you to back up just one thing about the cooking? Where do air fryers fit into all of that?
Where do air fryers fit in? It depends on how high the temperature is. Okay, generally speaking, you want to keep the temperature lower. And if you go to higher temperatures, like say baking, you still want to keep it 350 to, I wouldn't, you know, don't broil, bake. Whenever you can boil, you'll do better. And I don't know, what's the temperature on an air fryer?
It's like everything they cook in an air fryer is 10 minutes at 400.
Well, if it's 10 minutes at 400, it's probably, the air fryer is circulating that hot air, and so it has more of effect. It's just like convection oven. You turn the temperature down, and it penetrates deeper because you're moving the air. Bottom line is cook as low as temperature as you can. We make a lot of granola. I used to put it in the oven. Now I do it in a dehydrator. And the temperature is 180, so I know I'm going to have less glycation. And that's important. If you want to avoid high blood pressure and want to avoid kidney problems and lots of things, I mean, glycation affects everything. It really does. It's a #1 cause of aging. You can glycate your DNA. That's why diabetics have double the risk of cancer. They're glycating DNA. Yeah, you don't want to do that. You can anybody heard of arthritis? Yeah? Well, what happens? Well, you're stiffening your cartilage through glycation, and then it breaks easier and fractures easier, and you get more problems with arthritis, which is why if you want to cut down on your risk of arthritis, cut down on sugar. Yeah. And if you're going to eat a dessert, do what your mother said. Eat the meal first and then have the dessert. Why? Because if you have your tummy full of good high fiber food, it'll slow down the absorption of the sugar. Sugar's not a poison. It's what your body runs on. But if you absorb it too fast, like any internal combustion engine, if it gets fuel too fast, too rich, it doesn't run well. Ask anybody that repairs lawnmowers. Right, Frank?
Oh, yeah.
Yeah. You don't want a rich mixture. You want it just right. And that's the same with sugar. Yeah. Okay. Question, Dwight, or comment?
So, I'm Dwight Blaze, I'm a podiatrist. Every once in a while, Tim will send somebody to me who has diabetes with a hole in their toe. So it's my job to try to get that ulcer to heal. So every once in a while, that person has to make it to the OR because we need to amputate the toe. So back 20 years ago, 75% of the people would heal, but 25% of the people wouldn't heal. So what can we do about this? In the post-operative period, well, even before surgery, I'll ask the person, do you have access to a stationary bicycle? If it's safe for them to get on and off of it, of course. The success rate is now over 90%, about 95%. That means one in 20 people end up failing that amputation surgery, right? And then they end up having to have a higher amputation. And we don't want that. We don't want a below knee amputation because it complicates the person's life. They need a prosthesis. So activity and increased blood flow will allow people to heal. We don't want them just to lay in bed, quiet, and resting and recuperating. You know, I try to get people as active as early as possible.
Yeah, thank you, Dwight. You know, Dwight and I have worked together for 30 years. 36. And I tell my patients, if you want to keep your feet, see Dwight. If you don't mind losing them, you can go to anybody. There are other good podiatrists in town for sure, but Dwight's helped me and my patients many times. And you know, activity is so important for blood pressure, for kidney function. It's just really important. Thank you, Dwight. All right, any other questions? All right, back to kidneys here. Diet to preserve kidney function. Low in animal protein, low in sodium, high in potassium, high in vegetables, fruits, particularly melons, greens, beets, garlic. Low in cholesterol and saturated fat. Why? They cause atherosclerosis. Anything that gums up your arteries is going to cause kidney problems. High in fiber. Why? Fiber reduces inflammation, and it's the main way you get cholesterol out of your body. You bind it to fiber and take it out. That's cholesterol that you make as well as any cholesterol you might eat, because your cholesterol in your body is circulated through the liver and excreted in the bile, and you will reabsorb that unless you have a diet that's high in fiber, particularly soluble fiber. So if you want to lower your cholesterol and help your kidneys and help your blood pressure, get that fiber up there. How much should you aim for? At least 30 grams of protein, fiber a day is a good level to aim for. The average American gets about half that if they're lucky. More is better, but that's a good start. And low in refined carbohydrates and high heat cooked foods. That's really important. That's glycation again. That's attaching sugar to protein or fat or DNA irreversibly, and you want to avoid that. All right, questions? Oh, you've been here an hour. Maybe we should quit. Oh, we got another question in the back.
So, if you're becoming dehydrated and you're aware that you are maybe your sugar's high, can you take electrolytes that have potassium, magnesium, and...
You can take electrolytes in your food, in your water, but if, you know, I didn't even mention this, well, it's right here on the paper. There was a study published a while ago now, that was the Adventist Health Study 2. If you compared the standard American diet to a vegetarian diet or a vegan diet, there's a huge difference in kidney function. And another study by Adventist Health Study 2 was looking at water. If you have 6 or more glasses of water a day compared to people that have less than 6, you have a 40 to 50% reduction in your risk of heart attack and stroke. Now, I can tell you that just drinking 6 glasses of water a day, according to that study, will lower your risk of heart attack and stroke more than all the atorvastatin and other statins you can eat or take as pills. That's not to say they don't work. They do work. But water's simple. You lower your blood pressure with it, and then you lower your risk of stroke and heart attack. Drinking adequate water is important. Can you drink too much? Yes. There's a condition called psychogenic polydipsia. What does that mean? That you think you're dirty inside and you're a little bit loopy and off base, and so you're always drinking. They drink 2 or 3 gallons a day, and you can drop your serum sodium so low that when you stand up, you pass out. You don't want that. Stop short of that. But drink enough water. And 6 to 8 glasses a day is a good start, unless you're out working in the sun or get dehydrated, then you need more. Can you drink too much? Yeah, I mentioned psychogenic polydipsia. You can as well. My son did something a little kooky. He ran the 100-mile wilderness. He wanted to get the world record, and he held that world record for about 3 years. And his brother went with him, and the one that won the record was drinking electrolyte solutions. His brother was just drinking straight water, and he ended up in the ER with hyponatremia. Survived it. That means low sodium. So you can overdrink, but most of us don't get close to that. So 6 to 8 glasses of water is a really good thing to help your kidneys, lower your blood pressure, and lower your risk of stroke and heart attack. Very important. All right, maybe that's enough for one night. One more question.
I see that you have sweet potato or potato on the high potassium. Where does barley and quinoa fall into?
The potassium? Well, I'd have to look it up, but they're not real high in potassium, but they're wonderful grains. But they're not your number one sources. These are the top 12. You've been really good. I wish you low blood pressure and good kidney function.